Okay, so this afternoon we're going to start off with a panel. And the panel is So What Now? Moving from Ideas to Action. And I'm going to introduce two of the panelists, and then I'm the third panelist, so I'll introduce myself, I guess. All right, so our first panelist is Shirley Manley, and she is the interim dean at the School of Nursing at Charles Drew University of Health Sciences. She is an expert in developing and implementing community-based health promotion and prevention programs. For example, to improve communication systems in Oakland after the 1989 earthquake, she served on the board of directors for the California and National Alliances of Information and Referral Services. She has also worked with the American Red Cross, providing community-wide earthquake and fire preparedness classes, established shelters and information systems during the Loma Prieta earthquake, and developed the Summit Alta Bates Community Lifeline program to help frail elderly people live more independently. For her work in the community and clinical practice, Ms. Evers-Manley has won numerous prestigious awards for her accomplishments and contributions to the community and to nursing. So Dr. Evers-Manley, you here? There you go. And the second panelist is Todd Miller. Todd Miller is a medical doctor and director of the Global Health Education Programs at the UCLA Center for World Health, and also serves as Associate Dean for Student Affairs at the David Geffen School of Medicine at UCLA. Dr. Miller is the unprecedented 12-time recipient of the David Geffen School of Medicine's Golden Apple Award, selected each year by the graduating senior class, and is now a 2-time recipient of the Excellence in Education Award. I want to take your class. That sounds good. Dr. Miller's interests focus on innovative and diverse global settings. Ways to teach both the undergraduate and graduate medical education levels, both here at UCLA and in diverse global settings. Over the years, he has worked in Ethiopia, Zambia, Kenya, Rwanda, Zaire, or now the Democratic Republic of Congo, South Africa, Mozambique, Afghanistan, Myanmar, Ecuador, and Peru, and has made substantial contributions to the diarrheal disease control program at the World Health Organization during a sabbatical leave in Geneva. Dr. Miller is also founder of Partners for Pediatric Progress, a nonprofit project under the umbrella of the UCLA Center for World Health, committed to training partnerships in low-resource regions in sub-Saharan Africa and South America, to build local capacity and to improve the care of children in these settings. Dr. Miller, there you are. And I will be the third panelist.
How about this crowd? Hanging in with us. You've got stamina, persistence, energy. This really shows your commitment to the field. So I thought to get started, it might be good if we just, we heard your professional stuff. And if we heard just a little bit from each of you about your story, how you got to where you are now, and your interest. And I could ask you to tell us something you've never told anybody else before, but I won't do that. I'll just ask you to tell us a little bit about yourself and how you got to where you are. Dr. Evers-Manley.
Great. Thank you very much, and I would like to thank the planning committee for allowing me to come to have this discourse with you. The way I got interested in global health was actually as a child. For some of you, you may know the Evers name is a civil rights name. I am related to Medgar Evers. And so my family has always been as part of the civil rights movement. Even though we grew up as what you would say on the other side of the tracks, my mother had 6 children, and she raised 16 foster children from all different ethnicities. In addition to that, every summer, we had a person named Rhoda from India to come live with us. And I always wondered, why would Rhoda want to come live in this 3-bedroom home with 6 children, all these other foster children, and learn from us? And what I found is that not only did she learn from us, but we learned from her. And so I wanted to take all of that work, even as a young child, to be able to, once I came into nursing, was to be able to go out and help other people around the world. And I know in nursing, currently there's 19.3 million nurses around the world. The majority of those nurses, however, are in the United States and in Canada. When you look at Africa, for example, there's 11 nurses per 10,000 people. And so sometimes the nurses who is doing a lot of work at the front end, and because there's been brain drain, and you've heard that through the day in regards to physicians leaving, some of the tasks that physicians are doing are now being down-tasked to nurses. And if they have a crisis, whether it's a disaster, natural disaster, or medical disaster, sometimes the nurses themselves become the patients. And so we have taken nurses to Thailand, to Japan for the earthquake. We've been to Namibia, to the Philippines, to Uganda, to Tanzania, to Kenya, to we have some programs in Angola, Rwanda, so all over. And to help be able to not only help with providing nursing care, but also helping with the curriculum. One of the other things that we found, and I'll pass the mic back to you, is that in some of these areas that we go, for example, in Zimbabwe, the average age in Zimbabwe at the time when we first started going with HIV/AIDS and working with the Mother of Peace, every night we were there, we would hear people crying at night because of these babies dying. And every morning when we got up, they would sing, "Shirley, Shirley, Shirley's on the bus," and they would name all these people because they know that they made it through the night. And if you didn't make it through the night, you didn't hear that song, "Shirley was on the bus." And so we start working every 6 months, and individuals would come and work with us. And the nursing students there would be learning about conditions like Alzheimer's disease. Well, nobody lived that long. And so they was like, we're learning this, but we never see individuals. So we help them to retool their curriculum. And now all over Africa, nursing schools are beginning to retool their curriculum so that they can have a bachelor's level nurses, so that if there's a problem in Zimbabwe where there's a shortage of nurses, then maybe the nurses in Kenya or Rwanda or South Africa can go and help them. So that's what we're doing now, is helping not only to relieve and provide medical missions, but we're also helping the nursing schools retool their nursing curricula.
Thank you very, very much. Dr. Miller.
That was, thank you for sharing that. That was incredible. So I was raised in New York City, and then I went to a small school in Maine called Bowdoin College. It's a small liberal arts school. And when I went to Bowdoin, I wasn't initially thinking of medicine. I wanted to be a high school biology teacher. That was really my passion. And separate sidebar story, too long for now, but I had a role model, and got me thinking about medicine and whether or not I could explore my passion for teaching in the medical sciences. So I started veering towards medicine and ultimately towards pediatrics. And I had yet another role model, and one of the take-home themes is for the students in the room through this session is how important it is for you folks to connect with someone to run with, and the amazing impact that one individual can have in your education, your careers. And I wasn't going to mention this, but I just had this flashback of an elementary school teacher and a high school teacher that I still write to occasionally and thank them for the impact that they had in my life, because they were each so instrumental. But anyway, I had decided to become a pediatrician, and one of my pediatric mentors was an American woman who had been raised in India. And she told her dad was an economist for the Ford Foundation in Delhi. And she told me about her upbringing and said, you need to experience life in medicine in India. And we set up a global health experience. And this is 35 years ago, and I remember telling people that I was going to India to do an elective or to set up a global health thing, and everyone looked at me like, why are you doing that? And now it's a whole different world, and it's a whole different culture. And that was a very, very powerful experience for me, and I had a bit of the fever that I wanted to learn more. And after my training, when I moved out to join the faculty here at UCLA, I was in a more traditional general academic peds track until I earned a sabbatical, and through some serendipitous circumstances, was able to work for the World Health Organization. But it was serendipity. And I was pinching myself almost every day for 6 months, because I spent 3 weeks in Switzerland and 2 weeks in Africa. 3 weeks in Switzerland and 2 weeks in Africa. It was an incredible experience. The end of the sabbatical was temporally related to the Rwandan Civil War. And there were millions of refugees from after that genocide who were fleeing the country to bordering Goma, Zaire, then Zaire, and now the DRC. And there was a cholera and dysentery epidemic, and there were no pediatricians in the camps. And I went down to work there, and that completely changed me. And I came back to UCLA more committed than ever to nurturing opportunities for our students to sort of stimulate the next generation of public health leaders. And this, for the UCLA medical students in the room, this is way before the Center for World Health. It was an uphill battle, and there were a few of us on the faculty who were trying to encourage this, but we didn't have a unified force, or at that time support from the dean's office. And so I would go on these training trips really all throughout the world, and I would bring students and residents with me on most every trip. And then fortunately, the Center for the Global Health Education Program was created, and the Center for World Health, and we've been able to do this at a much higher scale. Along the way, though, I wanted to combine my passions for pediatric care, for medical education, and global health, and the culmination of those 3 areas of interest was the creation of a nonprofit to build capacity in low-resource settings. And our major partners are in Mozambique and in the Amazon region of Peru, outside of Iquitos. And just for some numbers and perspective, as you shared, when I went to, there are a lot of reasons why we chose Mozambique, but one of the huge reasons is how poorly ranked the country is on the United Nations Human Development Index. And at the time when I first visited, there were 10 million children in Mozambique, and there were only 10 pediatricians, 10 Mozambican pediatricians in the entire country. And we're a little bit better than that, but not much. And fortunately, we've been able to build a program with PEPFAR support, and partner medical school at UCLA and the Maine Medical School have now established a lovely partnership. And one of our goals here, I think, Tom, you could set us straight, is in addition to, after we talk about our backgrounds, to explore ways that we can nurture the careers of these folks.
Dr. Wipfli.
Yeah, so, wow, there's so many themes that have already been mentioned that I'd love to pick up on. One of them was actually mentioned by Chris Elias this morning when he said, be really committed and dedicated to what it is that you want to become, but don't be afraid to change directions. And I think that that's been one of the big issues in my life. I wasn't so maybe academic and focused as many of you in the room were when I was your age. In college, I like to say I majored in German and international relations. That was to be able to study abroad where my boyfriend lived and be able to speak to his mother. So I spent most of my undergraduate living in Switzerland, speaking German to, well, it worked out well, my mother-in-law. I had always been very committed to a global career. I always wanted to do something international. And I was about to get thrown out of Switzerland, and I needed to do an internship to graduate. And so someone I knew introduced me to someone who was working at the World Health Organization and gave me an internship. And I was a student in international politics at the time. And well, it really just sparked a whole life, obviously, a whole career, this one opportunity. I interned for a man named Derek Yack. Some of you may know him. He went on to be the head of the Framework Convention on Tobacco Control Secretariat during the negotiations of the WHO's first public health treaty. And I was part of that team with him. And then after I actually moved from Switzerland to the United States, because again, I followed my husband, And I got a job working with Jonathan Samet at Johns Hopkins at the Institute for Global Tobacco Control, and I've stayed with him now for 15 years. So I want to reiterate that idea of fabulous mentors being a real key to a really fruitful and exciting career. But going back to my experience at WHO, first thing is, how did I transition my internship into a career at WHO? I ended up staying for 5 years. Well, I like to say I was the best damn photocopier they ever had. I think that sometimes we go and we do our education and we think we're ready to take on these big issues. And in fact, that a lot of times we have to go and do this grunt work, and even that grunt work is really important to the success of these programs and can be very valued. And so I was able to show that, you know, I was committed, I was hardworking, I was an efficient photocopier, and those mean I was incredibly intelligent. So I ended up becoming a technical officer within a month, and going on and staying on the team for a number of years, and that was a fantastic opportunity. I mentioned I was doing my master's and then eventually my PhD in international politics. And so what's the link to health? Well, I found that while I was there at WHO and I was working on the negotiations of this first public health treaty, I realized that many of the most exciting innovations happening right now in global governance and in international politics and collaboration are happening around the health field, whether that's public-private partnerships or international laws or financing. There's so much exciting things happening, and so I really got captivated and really committed to this global health field. And it's something that if you had asked me earlier on in my educational career, or even as I was doing my master's, if I was going to be a health person, I would have looked at you like you were crazy. And yet I've found incredible success and passion and such a fruitful career out of that. So I really recommend that if a door opens to you, whether that's a practicum opportunity, a travel opportunity, a career job choice that you may not have thought, give it a chance and see where that door may lead you, because it could be a wonderful, fabulous opportunity you had not thought of. I wanted to just, something that maybe differentiates me. So I've been at Johns Hopkins and now at USC, directing a number of institutes, teaching, doing research. I travel all over the world. I have projects in really all the regions and doing everything that global health professionals do. But one thing that maybe differentiates me then from some of my colleagues is I also have 3 kids. And my kids are 13, 9, and 4. And so I think that the room is often in global health heavily tilted towards women. So I'd like to think of myself as providing some modeling and some career advice about how we, quote, have it all or not, and how we manage. But one of the things that I found is that in global health, family balancing doesn't necessarily work quite so well. So I've done family integration, and oftentimes when I travel, my children come with me, my husband comes with me, my mother comes with me, all kinds of people come along on the trips. I find that
you may have some of these guys want to come with you.
Yeah, actually, a number of these have come on with me, and I think they actually know my kids quite well. So yes, my family has grown, and it includes many people. And one of the things is, you might worry about, like, well, if your mom comes, do they think you're a kid? Well, look at me, they think I'm a kid anyways. So what they really realize is that I actually have a lot of respect for my mother, that I have a really strong family unit, and that I'm a real person, and I'm not just some foreign expert coming in. And I think that sometimes that really helps me build camaraderie and relationships with the people in the field that I'm working with. You mentioned your NGO, so I have to mention my NGO. So a few years ago, my children, obviously, they've traveled all over. I usually don't take them to too extreme of places, but I had promised them their whole lives that when they turned 10, they could come to Africa with me, to rural Africa. And so my oldest turned 10 just 3 years ago, and he begged and pleaded, and so I took him to rural Africa. I took him to rural Uganda with me, and he just completely fell in love with everything and all the people and the soccer games and the community and the kids. And he came back, and just last year he raised over $50,000 in the community, and he's been funding sports camps in the villages and building schools and doing all kinds of things. Of course, I help him a lot. I'm not going to say, but this is the privilege of being a global health mother. I'm able to help him and provide these opportunities to my children, and now our students are going and doing the public health education at the camps, and that's what I'm talking about, integration. It's really one big effort. It's not my career, it's my life, and it really spans all aspects, from family to career to everything.
Thank you, Dr. Wipfli. So I'm going to ask each of the panelists one more question, and I'll ask them to keep their answers relatively brief so we can have time. And if you have questions for the panelists, you can start lining up at the microphones. I have a question for you though, before you do that. How many of you are students? Wow, that is amazing. Okay. And so the question I'm going to ask, and now you can start lining up, is the question I will ask, and we'll start with Dr. Wipfli, we'll come back the other way, is if you had one piece of advice for students wanting to pursue a career in global health, what would it be?
Wow. I think it's to be open-minded and let the opportunities, create opportunities for themselves in whatever door opens for them. So don't be too overly focused on the one thing you think you're going to be.
Tom, before I answer your question, for Dr. Wipfli, can I hire your son for development work? I think my advice, and some of the med students in the room have heard this from me before, and that is that I want you guys, you should cast your net widely and think out of the box. And we get so caught up in more traditional pathways. We're going to go to high school, I'm going to go to college, I'm going to go to graduate school, and I'm going to pursue internships in all different fields. And it's okay to take a time out, and it's okay to explore some non-traditional things, and some things that were previously very non-traditional are becoming more traditional, and be really creative. And the wider you toss your net out there, and the more folks you reach out to, and the more web searching, and the more inquiries you send out, the more likely you are to catch a great fish and have an incredible life experience.
Thank you. My mother taught her 6 children and those 16 foster children to live by the letter L. And that's live, learn, love, laugh, and lift. And then she told each of us to also get a letter. Well, I adopted 2. One was C for compassion and commitment, and the other one was what Bo talked about earlier, and that was H for being humility, understanding that. Because when you go to these other countries, it's not about I'm coming and I know everything, but it's looking in that lens where I have searched myself, and I know that this is going to be a bi-directional learning experience. And whatever form that person comes to me, I'm going to accept him or her in whatever way that they come. And when you have humiliation, then all the work that you're doing, when you go abroad, people will come. We have no problems anywhere that we go. We have, and sometimes working with some of these health ministries, and you all know, can be very difficult. But I can take I have 300 pounds of medication that's being delivered to my office next week. I can go to Oakland and say to Congresswoman Barbara Lee, I need to get all these medications over to Uganda. Can you talk to the port to get them over there? Using that for free, and getting them over. So you're going to need all of your friends and your colleagues, and you're going to need to have that team that this whole conference is about. I'm working with engineers because I need point of testing and diagnostic devices when I go to the Philippines. Our instruments don't work a lot of times. It's too hot, and it's too humid. So I need your brain power to help me to be able to do a blood glucose in some of those places. So knowing that I need you as a team, and that's the part of lifting and learning together.
Let me ask another question, and we'll start back the other way. Dr. Evers-Manley, what, all of us who do this work, it can be difficult. As you say, there are challenges. What keeps you going?
I have an inner peace inside of me. I have worked in every area of nursing that can possibly be. I don't have any children. I wanted to have children. I didn't have any children. And the powers that be had me, during the time that I wanted to have children, work 8 years of pediatric hospice. And so, having that dichotomy of wanting to have a child and then working with children that were dying. There were 3 kids, Ray, Dustin, and Brandon, that were dying. They said, and Ray was 5 years old. She was dying of leukemia. She said, "You're not going to help me. I've already lived my capacity." She was very smart. She said, "But you're going to help children all over the world." And that's what has given me the power and the passion that I have to continue to do what I do.
Dr. Miller.
I think, my first reaction when I thought of what keeps me going is really this, is really the opportunity to share the passion and learn as much from the folks with whom I'm interacting. So it's really the teaching and the student interactions. I must admit, when you told your anecdote that the faces of the kids with whom we're working in these global health settings is those images and the impact of those images, those things are priceless to me, and the lessons learned on each of these experiences keeps me going, but it's really the opportunity to share it with folks along the way.
Dr. Wipfli?
Wow, yeah, I think my students are a huge source of inspiration for my career. I love them. I love traveling with them and doing this work. I agree, the people who you're working with in the field, they motivate you and they keep you going. And I want to go back to that idea of helping kids and helping people improve. I think that's so important. And I had a story of a little girl who I met at the HIV clinic at the referral hospital in Kampala, and she was 6 years old, and she was standing out in the ward, and she saw my cell phone and asked me to take a picture, and so I went to take a picture, and usually the kids kind of give you a flat face, and instead she went like that. She was just awesome. So we had a whole photo shoot, and she ended up crawling onto my lap, and she played Subway Surfer on my phone, because don't all 6-year-olds play Subway Surfer on the phone? My kids certainly did. And her name was Winnie. And we were waiting for a very long time for my meeting, and then finally I was taken away to the meeting. And when I came back, Winnie wasn't there, and I left. And I found out that she had been taking care of her HIV-positive mother in the clinic. She had left the rest of her family in a village far away, and she was sent to be the caretaker of her mother at 6 years old. And I'm thinking of my 6-year-old who cannot put on his underwear. And it wasn't until I got on the plane on the way home and I just collapsed in tears. And I thought, what did I do? I just left Winnie at this clinic with nothing. And she's amazing. And so, and some of you may know, I've actually sponsored a child now in Uganda. I have a Ugandan daughter who I take care of. And it's those things, I think, in our career that it just goes beyond our work and keeps us motivated and knows that we're having such an important impact. And I have my people. I look at my Facebook page and I see all the amazing things that my people are doing, and I think, wow, I'm in the right career, because these are my people.
So one final question for each of you. We'll start with Dr. Wipfli. What's next? What do you want to do next? What's your next aspiration?
Get tenure.
Where's your chairman? I'll talk to him.
Yes. I think I really want to continue to grow USC's global health. And maybe that doesn't fit so well in my tenure. But I want to see our programs develop. I want to see our student body grow and have more opportunities and do exciting things. I want to see a bigger impact on the field. I feel like that we could be so much more than the sum of our parts right now. We're out there, we're all doing so many things between our universities, and our students are doing so many things, and yet sometimes the impact on the ground isn't as big as it could be. So I'd really like to see us really mobilize all the resources that we really have in order to have a bigger impact on the ground. And so that's what I'm hoping that I can do, that I can inspire people and keep the momentum moving forward and achieve those SDGs.
I think for me personally, professionally, I've had a little bit less bandwidth for the global health work now that I've moved into the dean's office. But I think something that I'm struck with wearing both hats in student affairs and in global health is the incredible silos that we have internally and locally as well. And anecdotally, Tom's heard this before, but I had been working my second trip to Mozambique. I was in the main hospital, and one of my colleagues at UCLA in pediatric infectious diseases was in the hospital at the same time, and I had no idea that we had no idea that we were both there. Now that's a sad example of silos, and we've tried through the Center for World Health to break down those silos in a big way. But if on my wish list, my hope is that we can integrate experiences for folks in the different schools on campus and with the different universities within the city. So, for example, we're sending medical students to Malawi and to Mozambique. Well, there's a massive shortage of trained nurses there. So why aren't the nurses students going with the med students? And how cool would it be for a public health student to be going along? And then maybe we can get an engineering student and look at water safety, and some folks from Anderson, the business school, to look at microfinance in the village. So my fantasy would be for us to use opportunities like this to think more out of the box in ways that we can nurture the educational experiences and tap into this really rich resource of expertise on our campuses and maybe have an even bigger impact.
I'm going to simply say ditto to that. I think if we come together, we would be able to have more power to go over and help these countries wherever they are, because getting equipment sometime to the country can be a lot. Having, when you get there and you think you're going to have electricity, it's a problem. So if we had all the brain power of all of the different, disciplines, pharmacy, nursing, ministry, spirituality, even veterinarians. When we were there, people were bringing us pets. One of the things that I found strikingly different when I was going to these different countries is that many people would walk for days and stand in line for hours to be seen. And even though we've heard how much money that they make a month, they would always come and give us something, whether it was a cow or chicken, a goat or something. And the Mother of Peace, we actually had a farm there, so it kind of worked out well. But if you don't, it's like, where are you going to put these things?
Carry on.
You definitely can't bring them back. But sometimes the animals needed assistance as well, or we were planting gardens. And so here we go to countries where individuals come and walk for miles and they give us something, but we're in a country here and I give a screening, and to give somebody a screening here, they're saying, are you going to give me a voucher? So if I had a penny each time somebody said that to me, I think I would be able to buy me a boat. I know we have a ship. There's a ship named after my cousin, the USS Medgar Evers, and it goes on these Mercy mission trips. But having the transportation to get the things there sometime would be where my next area would be. And being able to have, I'm like your son in regards to getting monies, and I got, Northrop Grumman gave us a nice endowment to help with some of these areas. But in looking at all of the different ingenuities that need to occur, I don't know if you ever have an opportunity to go to the telemedicine conference, but there's actually a van that someone has made that operates on solar that has everything you need to have in it in the clinic. I don't know if have you seen those? And you just pop it into on a ship and you send it wherever you need to go. I need one of those. It's $250,000, so I'm working on it, but that would be my next goal.
I expect you'll be successful. Very successful. It's great. You know, this is a wonderful day, and it's great that our 3 universities could come together and work together on this conference. And I think the aspiration is that we might work together to actually have a uniquely Los Angeles response to global health issues and global health problems, and really helping the underserved around the world is a nice aspiration to think about. I thank all of you for being here, and thank all of your institutions for supporting this, and we look forward to the final session of the day. Thank you very, very much.